Welcome to PTCB 2026 Error-Proof Mastery. This video focuses on error prevention strategies, techniques, tips, and traps for the Pharmacy Technician Certification Exam. Welcome to this video on Pharmacist Intervention Mastery for the PTCB 2026 exam. We will cover key issues requiring intervention, including drug utilization review and adverse drug events, along with exam strategies. Let's distinguish between an adverse drug event, which requires causality and harm, and a side effect, which is known pharmacology. For reporting an ADE, capture details, document de-challenge, verify credentials, and submit via the MedWatch protocol. Master intervention questions by watching for terminology like therapeutic review and avoiding double negative traps. Use the quote 3DAP mnemonic to quickly recall critical issues: dose, drug, duplicate, allergy, and pregnancy. A technician's scope of practice for OTC recommendations is limited to locating products and reading labels. Crucially, all clinical suggestions must be deferred to the pharmacist to limit liability. Generic substitution is automatic if AB rated, while therapeutic substitution requires prescriber approval and a new prescription. Always verify NDC changes and update them AR as part of your tech duty checklist. Here is an exam sample question. A technician recommending pseudoephedrine for a patient on phenelzine requires alerting the pharmacist immediately. The correct action is B. Alert pharmacist due to hypertensive crisis risk. If a C2 stimulant is requested early, flag it for the pharmacist immediately. Calculate the day's supply gap and print the history. Remember, technicians have no authority to refuse sale. They must hand off data to the pharmacist for review. In packaging and adherence aid interventions, a technician identifying an error in a blister pack requires pharmacist correction. Any misuse of adherence aids still mandates a pharmacist intervention. For early refill requests, calculate the gap. For example, a 5-day early request for a C3 is outside the maximum 7-day cumulative early window. This misuse pattern requires immediate escalation to the pharmacist. Post-immunization care involves a 15-minute observation period. If an adverse event occurs, alert the pharmacist immediately for symptoms like wheezing. Mandatory documentation of the event and interventions is required in the vaccine log. In allergy cross-reactivity scenarios, such as penicillin and cephalosporins, pharmacist discretion is paramount. Technicians must flag the allergy in the system and never override alerts, even with prescriber notes. In a post-immunization event where a patient collapses, the correct first action is C. Call pharmacist immediately. Syncope requires professional assessment to differentiate between vasovagal and anaphylaxis. 3 Cypriot pounds. A4 inhibitors like clarithromycin interact with victims like simvastatin. When a heart stop alert fires, print the interaction sheet and attach it for pharmacist review. Never counsel the patient about the severity yourself. St. John's wort significantly decreases levels of drugs like warfarin. As a technician, ask about herbals and document in the patient profile. Any interaction alert requires immediate pharmacist intervention. If a patient on warfarin requests aspirin OTC and an interaction alert fires, the next step is C. Alert pharmacist. Bleeding risk requires clinical judgment, which is not within the scope of a technician. For safety questions, spend a maximum of 75 seconds. Keyword scanning for terms like consult or interaction will help prioritize choices. Always select the option that involves the pharmacist first for patient safety. Key memorization terms for the exam include DUR, ADE, syncope, and interaction. Any question stem containing these terms demands the pharmacist intervention option. For exam day prep, remember your night before checklist. Use the, quote, 3DAP plus hydrogen iodide mnemonic. Avoid speed traps and watch for subtle double negatives while reading every answer choice carefully. Error prevention is vital, especially with look-alike, sound-alike, or LASA medications. Tall man lettering is a key solution to visually differentiate similar-sounding drugs like hydralazine and hydroxyzine, a concept tested verbatim on the PTCE. Tall man lettering highlights the unique syllables in uppercase, preventing mix-ups. Focus your study on the top 20 LASA pairs that are most likely to appear on the exam. Physical separation of inventory is another critical error prevention strategy. Never alphabetize LASA or high-alert medications side by side. Also, physically separate different strengths of the same medication and use clear labels to avoid proximity mix-ups. Barcode usage prevents errors during counting and verification. Remember, overrides of a scanner alert always require direct pharmacist approval. A common exam trap is failing to rescan partial vials. Always rescan them. Always use a leading zero for dosages less than 1, like 0.5 milligrams. Not using a leading zero is an exam trap and can lead to a 10-fold overdose, which is a critical error. The trailing zero trap involves adding a zero after a decimal, such as 5.0 milligrams, which can be misread as 50 milligrams. Always select the label without the trailing zero to avoid a 10-fold overdose. This is a common exam strategy point. Be aware of error-prone abbreviations on the Joint Commission's Do Not Use list. If a forbidden abbreviation appears in a SIG, the only correct action is for the pharmacist to clarify the order. The 3-point check involves reading the label against the hard copy during counting, labeling, and bagging. Never batch process orders. This check reinforces a high error catch rate. Order processing strategy requires maintaining order integrity by keeping all items for one patient together until bagged. A PTCB trap is a scenario where the hard copy is missing. This is a critical violation. Minimize distractions during high-risk phases, like data entry and final verification. The best way to reduce errors is to protect the distraction-free zone, often referred to as the, quote, gatekeeper zone. Use a second identifier, such as address or date of birth, for patient verification to prevent wrong patient handoff errors. This is more reliable than a visual-only check, especially in scenarios involving siblings. These rapid-fire items test your knowledge of tallman lettering, sound-alike risk, and proper storage separation. Review the rationales to understand the ISMP and USP guidelines for patient safety. When a scanner beeps red for a high-alert medication, you have 3 choices: rescan, call the pharmacist, or override. Technicians must never solo override high-alert medications. Pharmacist approval is mandatory. For banned abbreviations, clarify with prescriber is always the primary and correct action. Never assume. Document the confirmation and then process the order to ensure patient safety. Recognizing the pattern of correct leading and trailing zero usage is crucial. The safe label correctly uses a leading zero before a decimal and avoids unnecessary trailing zeros. When calculating a day's supply, always perform a sanity check by comparing the calculated supply versus the SIG. A correct calculation resulting in an unsafe supply, like an underfill, should be flagged as an error. Leading zero formatting is essential in pediatric calculations, where missing or trailing zeros pose a risk. Points are awarded only when both the math and formatting are correct, ensuring clarity on the label. To avoid unit misinterpretation, the Joint Commission recommends using clear unit formats. Choose labels with plain milliliter per hour over mLHR to prevent ambiguity and errors, ensuring consistent unit usage. This timed practice block offers a 25-minute mixed review covering all error prevention topics. Use the instant feedback and deep explanations to identify and focus on your weak points before the final review. This video has provided essential error prevention strategies for the PTCB exam. Continue practicing these techniques to achieve error-proof mastery.